Hi, I'm Alyssa. I'm going to be your nurse today. We're going to be going over a head-to-toe assessment. Just want to let you know it should be taking about 10 minutes or so. Is that okay with you?
Yes.
Okay. Would you mind going ahead and stating your name and your date of birth?
AlyssaFehrenbacher, 07/08/1992.
Okay. Great. And then on a scale of 0 to 10 today, I want to check your pain scale, 0 being no pain at all, and 10 being the worst pain you've ever had.
0.
0 pain. Okay. And then also your allergies. Do you have any allergies to medications or to the environment?
No.
No. Okay. And then just your height and weight for me as well.
My height is 5'6" and my weight is 176.
Okay. And then I would calculate your BMI from there. Can you go ahead and please restate your name for me?
AlyssaFehrenbacher.
Okay. What year is it?
2020.
Where are we right now?
Doctor's office.
And what are we doing here?
Head to toe assessment.
Okay, great. Patient is alert and oriented ×4. I can observe that the patient is clean. She has good hygiene. Her stature is good. She's standing up on her own with ease. I can just observe that she responded to my questions, which means she could hear me and that she had good speech with responding. I'm just looking over the patient's skin right now. It looks like her skin's intact. I don't see any lesions. Just want to double check. It does look like the patient has a tattoo here on her right wrist. I'm looking at the patient's skin color. It looks appropriate for the patient's ethnicity, and the color is the same throughout her body. I'm going to go ahead and just check for the temperature really quick. Okay. Okay, so it looks like her skin, the patient is dry and warm to touch, and then her muscle tone is appropriate for her skin and her age. Just gonna go ahead and check your skin turgor real quick. Okay, so that is elastic. Her nails look like they are firmly attached here. It's pink in color, which means good perfusion. Her capillary refill is in less than 2 seconds, and I don't observe any clubbing. Okay, and then I'm just gonna go ahead and can take a look at the patient's face. It all looks symmetric, her eyes, eyebrows, and ears. I'm just going to check your scalp. Okay, I don't spot any lesions on her scalp. Her hair is evenly distributed throughout her whole head, and it looks like it is moist. She doesn't have any facial grimaces. Her eyebrows and eyes look appropriate. Her eyes, there's no drainage or redness, and her eyebrows and eyelashes are both evenly distributed. I'm just gonna go ahead now and take a look at your eyes. If you can follow my pen light for me. Okay, and then we're gonna go over here as well. Okay, and then take a look at my pen. Okay, so it looks like her pupils are equal. They are round and reactive to light with accommodation. I'm gonna go to your ears now. Just take a look at these. Okay, so I don't see any lesions on her ears. Skin looks intact. There's no drainage from her ears. Do you have any exposure to environmental noises?
No.
Okay, and do you have any hearing aids?
No.
Okay, how do you clean your ears?
I use a Q-tip, but I don't go all the way in.
Okay. Sounds good. So her ears are lined up with her eyes. Her nose now is symmetric to her face. It looks like it is midline. I don't notice any lesions around her nose at all. Her nostrils look open and clear with an open airway patency. There's no drainage from her nose. And then I'm going to go ahead and ask you to open your mouth. Can you say ah? Okay, her uvula rises and falls. Her mucous membrane and mouth are pink in color. There's no lesions and there's no odor. I see that her teeth and gums look intact. If you wouldn't mind just following me now, I'm going to ask you to bring your head up and down like that. Okay, and then go side to side for me. Okay, and then ear to ear. Okay, it does look like the patient has full range of motion of her neck. Now we're just gonna go ahead and I'm gonna ask, do carotid pulses. Okay. Okay, patient's carotid pulses have a regular rate and rhythm. They are equal bilaterally with a +2 amplitude. I'm going to go ahead now and check her radial pulse. Okay, and then let me just check them here on both sides. Okay, so patient's radial pulses are 72 beats per minute, have a regular rate and rhythm. They're equal bilaterally with a +2 amplitude. Okay, so now we're done with your radial pulses. I'm going to go ahead and listen to your lung fields now. I can observe that the patient has been breathing effortlessly and with no accessory muscle use. I'm going to go ahead and check 6 anterior and then 6 posterior lung fields and then 1 on each side laterally. I'm going to go ahead and go under your shirt if that's okay.
Yes.
Please take a deep breath in and out every time I move my stethoscope. Okay, just listen to 6 in the front. Okay, on this side. Okay, and then on this side. Okay. I just listened to 6 anterior, 6 posterior, and 2 on her lateral sides. The lung sounds were clear and equal bilaterally in all lung fields. I'm going to go ahead now and check your heart sounds. So there's 5 heart sounds, 8 to 9, and I'm just going to go ahead and go under your shirt again if you don't mind.
Okay.
Okay. I just listened to all 5. I heard S1 and S2 in all 5 spots of the heart. And now I'm going to ask you to lie down so I can listen to your apical pulse. Lift your shirt up again. And listen to 1 full minute. Okay, her apical pulse was 72 beats per minute. It was regular rate and rhythm. I'm just gonna go ahead and check your abdomen now, if you don't mind just staying there. I'm gonna lift your shirt up just to see how it is. Okay, so it looks like she has, I'm just noticing there's no lesions, the stomach looks flat and there's no distensions. I'm gonna go ahead and ask you, do you have any abdomen pain today?
No.
Okay, and then when was the last time you urinated?
30 minutes ago.
Okay, and then when was your last bowel movement?
2 hours ago.
Okay, I'm gonna go ahead and just give a quick listen to all 4 quadrants. Okay, bowel sounds are active in all 4 quadrants, and I'm just gonna go ahead now and feel. Okay, the stomach and abdomen feel soft to touch. There's no tenderness and there's no pain when there's touching. Okay, that should be it for the abdomen. Put your shirt down. You can go ahead and sit back up. Okay, we can just go ahead. I'm just gonna do some maybe a range of motion. So if you can follow my arms, can you go up and down? Okay, and then can you go like this with your wrists? And then wiggle your fingertips. Okay, the patient has full range of motion in her upper extremities. We're gonna test for your muscular strength now. Put your arms like this. Go ahead and push against my wrist. Okay, and then go ahead and pull towards you. Okay, and then put your arms up. Don't let me push down. Okay, patient has 5 out of 5 muscular strength in her upper extremities. We're gonna go do the same here, down below to your lower extremities. You go ahead and kick both feet out and in. Okay, and then push your feet down like a gas pedal up and down. Okay, and wiggle your toes for me. Okay, great. Patient has full range of motion in her lower extremities. We're gonna go ahead and test your muscle strength now. So go ahead and push against my hands. Okay, pull your legs in. Okay, and then don't let me push down. All right, patient has full 5 out of 5 muscular strength in her lower extremities. I'm gonna go ahead and feel for her dorsalis pedis pulse in her feet. Just relax your feet, please. Okay, so she has a regular rate and rhythm. It's equal bilateral with a +2 amplitude. Can you please stand up for me? Can you walk this way and then walk back to the table? Okay, patient looks like she has an even, steady, and smooth gait. I think that's going to be it here for our assessment today. If you have any questions, please let me know. I will give you your call light. It's right here, so you can do that. Put the bed at the lowest position, and it's going to be locked. We have 2 side rails up, and that's going to be it. If you have any other questions, please let me know, okay?
Thank you.
All right.